The title of my research is The Effects of Deep Brain Stimulation on the Strength Training Participation and Mobility for Parkinson's Disease Patients. Okay, so the background. Parkinson's disease is a progressive neurological disorder that has symptoms of bradykinesia, tremor, rigidity, and problems of gait and mobility. To reduce the symptoms of PD, strength training has been recommended to PD patients, and it was effective. In addition, deep brain stimulation, which is a surgical technique, and it is also one way to reduce the symptoms of Parkinson's disease. Even though this technique improve PD patients' agility and motor performance, there has been limited number of studies regarding DBS patients' exercise participation frequency and their mobility performance. The purpose of this study is to compare the DBS group and non-DBS group in strength training participation hour, days per week, and their mobility performance. There are two hypotheses of this research. The first one is Parkinson's disease patients with deep brain stimulation have better mobility than non-DBS patients. And the second one is Parkinson's disease patients with deep brain stimulation participate more in strength training than non-DBS patients. We collected the data from Fox-Den trial, which is sponsored by the Michael J. Fox Foundation for Parkinson's Research. And it is the largest Parkinson's disease-based foundation in the world. And they updated the data monthly, and the data includes questionnaires regarding day-to-day living with Parkinson's disease, genetic information, and passive data from smart technology. And Fox Insight database can only be accessed by qualified researchers who are interested in Parkinson's disease. For method, a total of 4,806 participants' data were analyzed, and the population of DBS patients was 363, and the population of non-DBS group was 4,443. And we conducted Mann-Whitney-test for strength training participation hours, days, mobility, and years with Parkinson's disease, and also we conducted independent sample t-test for Parkinson's disease diagnosed age, and the alpha was set at 0.05. This is the result section, and the Mann-Whitney-test shows that there was no significant difference between the two groups in strength training hours per week variables. And also, the Mann-Whitney-test also shows that there was no significant difference between the two groups in strength training days per week variable. In the mobility indicator, there was a significant difference between the two groups in mobility. So non-DBS group showed a better mobility compared to the DBS group. DBS patients have had Parkinson's disease more than non-DBS group, and this difference was statistically significant. Majority of DBS patients have had Parkinson's disease more than 11 years, and half of the non-DBS group has had Parkinson's disease less than 3 years. And DBS groups diagnosed Parkinson's disease at their age of 51 years old, while non-DBS group diagnosed Parkinson's disease at age of 61 years old. And the gap between these two groups were more than 10 years, and it was statistically significant. In conclusion, unlike our hypothesis, there were no significant differences between the two groups in strength training participation frequency. In the mobility indicator, the non-DBS group showed a better mobility compared to the DBS group, and it was statistically significant. However, DBS patients have Parkinson's disease for a longer period of time, and since Parkinson's disease is a progressive neurological disorder, we can assume that DBS patients have severe symptoms of Parkinson's disease. And even though DBS patients have low mobility and have had Parkinson's disease for a longer period of time, they participate strength training as much as non-DBS patients who have relatively mild symptoms of Parkinson's disease.